Welcome, everyone. It's a real pleasure to host this presentation today. My name is Greg Leslie. I'm the Director of the University of New South Wales Global Water Institute, and I'm coming to you from Bedjigal land here in Sydney. And I just want to begin by acknowledging the traditional owners of the land that I'm on and pay my respects to elders both past, present, and emerging, and recognise that this territory has never been ceded. And so I invite you to also recognise the First Nations people and traditional owners on the land that you're on today. We apologies for the technical problems at the start, but we had, it's always embarrassing when it happens to the host. But look, we're gathered here today to talk about a really important issue. It's exploring the pathways and connections between climate change, water security, and their impacts on mental health. We know that there's a lot of anxiety around the effects of climate change, particularly amongst young people. And just in the same way that the water systems, the water environment is one of the ways, one of the vectors that the energy that's being stored in the atmosphere is expressed through storm surge, through more intense rainfall events. What we want to look at today is the connection between our changing climate, our water systems, and people's anxiety and concerns and the impacts around those changes in the water systems on their mental health. So it's an exploratory session. We've got three tremendous speakers. We'll lead off with our first one. There's opportunities for those of you online to put your questions in the comments box. The way it will work today is that each speaker will quickly go through their preliminary thoughts. We'll then have a bit of a dialogue backwards and forwards with our three speakers, and then get to the questions during that time. So please just put your questions in the chat and we'll address them. So with that, I'd like to introduce Sarah Louise Young. Sarah's at Northwestern University, trained as an anthropologist with degrees from, her PhD was at Cornell University. I've had the privilege of working with Sarah on using the tremendous water and food insecurity tools, survey tools that she's developed with an Indigenous community in Western New South Wales, the Dharrawa community in the town of Walgett. So Sarah is going to lead us off, and Sarah will talk to us a little bit about her research in the development of those survey tools, but also where her work is going on the connections between water insecurity and possible links between climate change, water, and mental health. So over to you, Sarah.
Thanks, Greg. It's a real pleasure to be here. I'm looking forward to learning from everyone, including those of you who are in the audience. I have been tasked by Greg, and I always do what Greg asks me, to give like a bit of an overview of how we are measuring water insecurity. Then I'll wax poetically near the end about how we can take this to climate change and mental health even further. So I'm going to tell this story by giving just a bit of a backstory, which is 10 years ago when I was like a baby assistant professor this tall, ready to take on the world. I had my first big grant. I had $1 million from our National Institutes of Health to understand how food insecurity shaped maternal and child health. And as Greg mentioned, I'm trained in nutrition. So we know very well how to measure food insecurity by asking about people's experiences with worry about food and changing the meal sizes. And as an anthropologist, I wanted to make sure I was asking questions that people really cared about. So we gave women cameras and we asked them to take pictures of that which shaped how they fed their babies. And to my great surprise, we got a lot of pictures of water back. And there are so many stories I can tell you about these photos. I'm not going to do that now. You could ask me about it in the Q&A, but these photos made me think, like, could we measure experiences with water insecurity as well? Remember, the grant was supposed to be about food insecurity. So I was this eager baby professor, and I thought, like, we had this great study design, repeated measures across 2 years. Could we just add a measurement of water security to that study design where we're looking at food insecurity? So I quickly got a lay of the land of how people are measuring water insecurity. And it turns out that experiences are not usually measured. So water security is a term that covers all manner of sins. People use it to mean often water availability. And we're good at measuring physical water availability. I mean, hydrologists think it could be better, but from a public health point of view, we're pretty good at it. We're also pretty good at measuring infrastructure. The JMP drinking water ladder, which is a sustainable development goal indicator, measures that right now. When we can get at safety with a range of diagnostics. But what was missing, and what I was hearing about, is these experiences with water that were really shaping how women live their whole lives, in fact. And this idea is so with what the current indicators were, going back to this photo, she had infrastructure. There was a huge sim tank, like a place to store water on premise, and Lake Victoria was not very far away from her. But she had this picture taken of her with her mother-in-law, who was not letting her use that sim tank, which means that she needed to go to fetch water. And in the process, she's very pregnant. Her belly's out here. You can't see because she's face on. She went into premature labor and had some very serious health issues. So using standard indicators of water security, she would be okay, but we know that she wasn't, and we needed a way to measure that. And this was, to me, a very obvious idea to measure access and use, because, like I said, this is how we measure food insecurity. So I'm just borrowing from someone else's playbook with all that came next. So I saw a need to develop a scale to measure exactly these kinds of experiences, and we did so in Kenya. And as an anthropologist, one of our favorite things is cross-cultural comparisons. And so the next step was to to develop a tool that would work globally. And with much blood, sweat, tears, gray hairs, we collected a lot of data in a lot of very different places to stress test these candidate items that we thought were candidates for a globally valid scale. And I'm going to not tell you about scale development. There's plenty to read about it, and you can see these papers here. You can get to these. All these papers are open access, and they're on wisescales.org. I'll just say for today that a miracle occurred, and we went from 32 candidate items to 12 final items. And those final items ask about, like I said, experiences like, did you have to change the food you cooked because of problems with water? Were you angry about your water situation? And this characterization of water covers too much water, too little water, or water of poor quality. It's always problems with water. The responses are scored. So if you are sometimes worried, you would score a 2. If your water supply is never interrupted, you would be a 0. So the range is 0 to 36, and it takes 3 minutes to administer. So fast forwarding another few years, so you started in 2013 in Kenya. 2019, we had the global scale developed. Now the wind is a bit in our sails, and there's a broad uptake of the scales. So any of the countries in green, we have nationally representative data for. The dots in red are places where it's been used in a particular site, but this map is very out of date. And in fact, there are many more organizations that have used it. In fact, I'm just back from the governor's palace in Nuevo Leon, Mexico, where they have signed a pledge to use water insecurity scales to measure the progress in their state towards towards water security. Many national governments are signing on. It's really exciting, and there's some, I think, very exciting developments in Australia related to using this for advocacy. So with this higher resolution of measurement, so these are the 12 I-wise items. There's a household version that's H-wise, and there's an individual version that's I-wise. We can see more precisely who is being left behind because we're measuring it at the level of the individual. So we can see how it varies by, for example, gender, or by age or ethnicity. And we can also see how it's also more holistic. So in those indicators I showed you before, where the emphasis was on drinking water, but here we can look at water for hygiene and water for cooking as examples. And this gives a different picture of what than what the typical indicators give. So like, according to this, 1/4 of Egyptians are water insecure. I just randomly picked Egypt. But if you look at which Egyptians don't have water infrastructure, it's less than 1%. So that's a very different picture. Now, you can care about water insecurity if you care about water. But the beauty, I think, of this kind of indicator is that we can tie water insecurity to all kinds of other outcomes, including economic well-being, nutrition, physical health, and psychosocial health. And just as an example, we partnered with the FAO, Food and Agriculture Organization, and they had measured food insecurity experiences in 31,000 households. In the same 31,000 households, we had measured water insecurity, and we could see that anyone who was water insecure was 2 to 3 times more likely to be food insecure as when controlling for all the sort of known confounders of food, well, many of the known confounders of food and water insecurity. So to our topic today, that was kind of a long backstory, but I thought it was important to understand what the exposure is we're talking about. So we can measure water insecurity if we care about water. We should measure it also if we care about economic well-being, nutrition, physical health, psychosocial well-being. And we have data on the pathways between water insecurity and all of these outcomes. But what we have not done yet, and which is like a clear need, is to understand how climate change and water insecurity go hand in hand. Now, this is not my line, but I love it. I heard it from Andy Roby, who is at FCDO in the UK. And he said that if climate change is a shark, then water insecurity is its teeth. And that feels very apt as we are seeing, the landslides in Vermont, as we're seeing, droughts here, as we're seeing, so I feel like a really important next step in the water security literature is to tie water and climate together better than what we've been doing. And I'm so grateful to Claire Dooley, who is a professor at London School of Hygiene and Tropical Medicine. We are working with her and her group to, we have geotag data on all of those nationally representative data that I showed you. And we're trying to pin climate events to water insecurity. And our kind of pie in the sky is to then at the same time measure mental health outcomes. So I think I'll stop there. There are a number of uses for these scales, and I think that's part of why they have caught on as they have. I'll be happy to talk more about them in Q&A, but I'll just appreciate Greg and Ginger for organizing this and turn it over to my colleagues.
Thank you, Sarah. And no, that was terrific. Look, also my tardiness in trying to get my computer to work this morning, I neglected to mention our partners. We're indebted to Claire and her colleagues at the London School of Tropical Health and Medicine, and who's been very instrumental in helping us pull this session together. So welcome, Claire, and appreciate your help. Okay, our next speaker is a colleague of mine here at the University of New South Wales, Zhao Feng, as a professor in the School of Population Health. Zhao leads, or his programmatic research covers many areas, but it's been really focused on population well-being and improving population well-being by identifying things in the environment that we can control. So factors such as disadvantage, access to urban green space, access to water, and how these then feed into shaping health and development at trajectories, and also, unfortunately, the inequalities that have impacts, particularly on newborns and children and adolescents, which I think are going to be the big focus of this. And I'll pass over to Zhao now and talk about her work on natural solutions and natural prescriptions for improving mental health, which again is picking up on Sarah's last comment, is how potentially we can blunt those teeth of the shark of climate change through which a lot of these impacts are going to be felt. Zhao, thank you very much. And thank you for helping me get logged in this morning.
No worries. Thank you. Thank you very much for inviting me, Greg, and it's fantastic to hear the work that Sarah doing. I'm going to share my screen. You can see my screen? Yeah? Oh, good. Wonderful. Yeah, great. So as Greg introduced that, I'm professor in urban health and environment at School of Population Health at UNSW, Sydney, Australia. So I just have a brief intro about myself, but also then want to tell you a little bit of the work I'm doing on green space and mental health. So I'm also a founding co-director of Power Lab, a population well-being and environment research lab, which is a multi-university collaboration between UNSW and also University of Wollongong in Australia. Those are the photos we took before the pandemic, and we used to have annual Power Fest as a conference, and we also educate and support the next generation. So we regularly bring speakers just like today from Australia, but also overseas on our campus to give seminars. And also we empower our students and early researchers by giving skill-based workshop, which we call Power Tool, and a regular journal club organized by our postdoc PhDs. So what do we do in Power Lab? We conduct our research, by the name you can tell, is investigate the relationship between population, well-being, health, and environment. So we have few of those flagships project, which is focused on green space and health. And you can see this is just some of the papers we published just on green space and health. Probably in the last 10 years or since I established the lab in 2016, we have like 70, 80 publications just in this research theme. So I'm glad that with combined effort, and we have a lot of research publications, and I was able to secure over 21 million research funding for my research group, and many PhD students graduate from Power Lab. And we are able to translate our research into the policy. And there's even one I show here, not only in Australia, locally, such as Sydney, Wollongong, but also overseas, such as Professor Sicer actually used my research. This 3300, the 30% is continuous show in my research use big data, and that has been applied and promoted overseas as well. And we really glad that we're able to empower the next generations of research in the environment field. And many of the postdoc and PhDs are now working with the government and or working in prestigious universities. To talk about mental health today, as you can see, this is at our local NSW, the state we are in, one of the largest state from the population sense in Australia. And on their planning, Department of Planning website, they directly cite my research showing that is why they need to have more tree canopies, have more trees and green space. And in fact, there's just over 1 million trees, actual trees have planted in Sydney, which is led by Stephen Hartley's team in the DPI, the Department of Planning. And we expect there will be another 5 million trees will be planted, established in Sydney in the next 6 years. So you probably by now think, well, yes, it looks great, right? And if you have trees and the parks near your home, this is the only reason that is good for our mental health. Well, Today, I'm going to talk briefly about it. Many years ago, clearly before pandemic, and I still look a lot younger, when we exploring the pathways between green space and also health. So this paper now published is one of the best cited paper in this field. So what the pathway we're talking about is that first is building capacities. It's not difficult to understand. When you go into a park or neighborhood, where you have a lot of green trees, but also have this walking path, you do running, which is good for your physical health. It's also good, after a lot of sweat, and you probably will have a better sleep. And you might meet your neighbors, and which those social contact, you say hello, morning, those maybe have a quick chat. It's all really good for our mental health as well. And they also use where the second pathway, which we call restoring capacity. There are always those days we feel, oh my God, it's just exhausted day. I wish I could do 1, 2, 3, 4. I have that experience, certainly. And I walked into our local big Centennial Park and just sitting there, do nothing except sitting there. Just close my eyes, listen to the bird sounds, walk around. And, after half hour, I felt very refreshed. That help us to reduce the stress, recovery, and also help us be, more concentrated later. So the last pathway, the third pathway, is reducing harm. And we know that, really hot day and with a lot of noise, and also we're living somewhere continuous suffer air pollution, we're not going to have better mental health. We probably will be a little bit grumpy in those really hot days, especially in Australia summers. But green space could reducing the heat, noise, and air pollution. That also then help our mental health. So we think in general, those three pathways could help us to support our mental health between mental health and green space. So, well, it seems more green space in general, and we'll have better mental health. But job is not done, because not all green space are the same. Some green space are better than others. So I'm going to quickly show some examples that from my research. So this is a research we use Australia longitudinal study of children. So what we find is that not only children need exposure to a good amount of green space, but it's crucial the quantity. As you can see from this chart, that if children who always live with good green space quality, and they seem to have better mental health, and especially when they grow, this mental health well-being gap is actually widened between the one who always exposed to high quality green space and the peers who have not have the opportunity exposure to the high quality ones. And we also find that green space quality is crucial to help women to reduce the risk developing possible psychological distress. And it could be 26% lower odds, which is very significant. We know in Australia, 1 of the 5 women after give birth, they will suffer the psychological distress. And this is doctor diagnosed. So probably after, very serious, a long time period, when you went to see a doctor. But a lot of more women we know after give birth, because the hormone change and all, the new life in is going to cause the stress. And so the real figure is more than the 1.5. But if we could provide high quality green space, and that is fantastic news, even after, we consider about whether people have higher income or low income, and that could still achieve 26% lower odds of developing the psychological distress after give birth. It's brilliant. I conducted a national survey with my colleague during the pandemic, but this is not the lockdown time. This is that the people actually could walk around, but most of us still mainly working from home. And it shows that high quality green space and how people feel more connected, and also they feel active and relaxing. That's not a surprise. But what kind of quality of green space we need, because quality means very different from different people. So I have this project funded by Australia NHMRC, National Medical Research Council, and also UKRI, with colleagues in Australia and the UK to figure more about what features we need and the quality of park we need for everyone. So we are still working on that. Hopefully we'll have more to report soon. Then now we have the quantity. Australia government at least is working on it. And also I know a few of other countries as well. And also we're thinking about improve the quality. So you think, okay, job done. People are going to enjoy all those benefits of the green space, the nature, on their mental health, on their physical health. But unfortunately, that's not quite the case, at least not for everyone. So in this national survey I conducted during pandemic, and which shows that 1/3 of Australians actually did not even spend 2 hours a week in nature. 2 hours is not very long. It's not, say, maybe you just have a walk in your local green space, or if you're lucky living close to the beach. We're talking about like half hour or less, or maybe just 2 hours in the week during the weekend. But 1/3 of Australians has not achieved that. But on the other side, they said 82% of them and the whole population are open to visiting nature. And if their doctor actually recommend them and it's good for their health. So we then get very curious, say whether this nature prescription issued by health professionals or health workers actually works. And we conducted this systematic review and meta-analysis recently published at the Lancet. And it shows nature prescription does help reduce the risk and developing anxiety and also depression, and helps better manage it as well. And also lower blood pressure. So if you're interested, and please have a look about this systematic review. And we also now have a newly funded MRF project called a PANDA trial, physical activity in nature for cardiometabolic diseases in people aged 45 and over, to really start thinking and working on implement nature prescription in Australia. So if you're in Australia and you're interested, be part of the trial and please have a look. But if you're from overseas and you're looking forward to collaborate in this field with us, please get in touch. Thank you very much, Greg, and very looking forward to discuss with you and colleagues.
Thank you very much, Xiao. That was terrific. All right. So the third panelist that we've got for this morning is Mr. Jimmy Hilly. And Jimmy is joining us from the Solomon Islands. And again, I think where the effects of climate change are being felt the hardest and the most is in our island communities. They're most vulnerable to sea level rise. And Jimmy is a senior environmental officer in the Ministry of Public Health in the Solomon Islands. He's worked across a number of areas in environmental health, including impacts assessments, air pollution, climate change, and waste management. Very big on stakeholder collaboration, working with youth, and placing health issues at the centre of decision making. So Jimmy, thank you for dialing in from Honiara, and we look forward to listening to your presentation.
Thank you, Greg. Let me share my screen. So can you see my screen?
Not yet, but it's okay. You're not the only one that's had tech problems this morning.
And I'm so sorry about this.
No apologies necessary.
Yes.
This is looking better. Excellent.
Can you see my screen now?
It's beautiful.
Yeah, perfect. Sorry, is it showing?
It looks great, Jimmy. Yep. Climate
Gorgeous.
change,
Perfect.
water security. Yep. Thank you.
Thank you, Greg. Thank you, Ginger, and my other panelists, and also the guests, our guests as well this morning, with regards from the Solomon Islands. Now, this morning, I would like to thank Greg and the team for giving me this space to share my experience and that of my colleagues in the Ministry of Health, and also my counterparts from the Ministry of Environment and also the Ministry of Mines and Energy. So I'll be sharing with you with regards to water security. I'll be sharing with you my experience and that of my counterparts in the Climate Change Division of the Ministry of Environment, and also in the lens of my counterpart in the Water Resource Division of the Ministry of Mines and Energy. And for the mental health and climate change portion of my slide, my presentation will be from the lens of my colleague from the Mental Health Division of the Ministry of Health and Medical Services. So just briefly before I proceed, just in case you don't know where Solomon Islands is, it's located northeast of Australia. It's comprised of 900 plus islands. Our landmass is around 20,000 square. Our population is approaching 1 million. It's a very small population, and 80% of which reside in the rural communities of our country. And as Greg mentioned, we are susceptible to the impacts of climate change, and we are experiencing, the impacts, natural disasters every year. The intensity has increased in recent years. Now, for water security, there are 3 main sources of water in the country. First is surface water. And for surface water, it's usually directly from the streams and the rivers where communities will access water, or it's collected in a dam, piped to a storage tank, and from the storage tank to a reticulation system to the end users. And so these are typical standpipe in our rural communities where communities would share communal standpipes. Our treated water is only in the main capital, where our end users have access to chlorinated water. Again, it says chlorinated water. During high rainfall days, when our surface water would experience high turbidity, we would experience high turbidity as well at the end user level. For wells, it's usually open wells, or it's protected, where a hand pump is placed on top to extract the water from the wells. And for our low-lying areas, which do not have access to either of the other 2 sources, the only option is rainwater. So this is a typical rainwater catchment in our rural communities. So in terms of coverage, our percentage of population having access to basic water is around 64%, which is slightly higher than Oceania. However, it is still a concern. It's still low compared to the global average, and a big portion of our population still don't have access to basic water. And that has health consequences as well. As you could see on the slide, around 10% of our mortality is attributed to unsafe wash services. That's including water and also sanitation. And that's quite high compared to 12.4 global average. So what are some of the challenges? As I mentioned earlier, we are susceptible to the impacts of climate change. We experience natural disasters every year, like once or twice or even more in a year. And usually during natural disasters, one of the infrastructure that's usually affected is our water infrastructure. Also, this issue of governance and leadership, our water sector is fragmented, to be honest. The policy level governance sits within the Ministry of Mines and Energy, which oversees water for the whole country. Now, the rural water aspect of the overall water arrangement sits within the Ministry of Health, particularly the Environmental Division, which I'm a part of. And for urban water, it's under the responsibility of the Water Authority, which is a state-owned enterprise. And it's more on profit, more on and not so much on service delivery. Also, under leadership and governance, you would find like this is a policy on catchment protection, but again, implementation, enforcement is a challenge. Another key challenge as well is political, where you would find government ministries doing their or implementing the water programs, but at the same time you would have political interference as well into the operational aspect of these programs. And so you would find examples of resources diverting to communities who are not in immediate need of water, leaving other communities who are in dire need for assistance. Another key aspect is our geography. Our country has so many islands spread across our country, and so access is a big issue, is a major issue. And I would, based on the experience of my colleagues in the rural water and sanitation program in our office, it's very costly to implement programs in the outer islands where it's only serviced by ferry, by boat, at least once or twice a month. And materials have to be sourced from the city, and it's very costly to have them shipped to those islands where it's needed for this program, water programs. This is also this donor funder dependent syndrome. It's sad to say, ever since the government started implementing water projects in our communities, we have donor partners involved as well. And so you'll find communities developing this culture of depending on donors for everything, even as far as maintenance. There have been efforts in the past to build, sense of ownership in communities, but it is still a major challenge. Next is technology. Figure 6 is a typical example in our effort to introduce, appropriate technology. There was this project piloted in one of our islands. It's a desalination plant. It had good outcomes. Water quality was amazing. However, when the project terminated, there was no continuity. One of the major factors was technology was from Europe, and so all the materials had to be shipped from Europe, and so it's not sustainable. It's not appropriate for our country, so there's no continuity. Lastly, but not the least, data. Our Ministry of Environment, through the Climate Change Division, has done community vulnerability assessment since 2019, and so far, because it's fully funded by the government, and so far they only reached 600 communities, which is very small. It's not even a quarter of our communities nationwide. And based on this vulnerability assessment, of these 600 communities that were reached, 70 to 80% raised concern about water, access to water, and also water quality. Also on water, on data as well, our health data, because one of the good indicator to measure access to water is health outcomes. However, our health data doesn't go right down to the household level. It only reaches the community health center level, which is serving a number of different communities, different villages combined. So that is still a challenge, linking health data to water. This is a major concern, water and healthcare facilities. Around 60%, this is both rural and urban, have water on premises. And of the 67%, only 35% have access to safe drinking water. And these are health facilities, mainly in the urban centers, who have access to chlorinated water. The 60% are communities in the rural communities. Yeah, health facilities in rural communities who don't have access to treated water. And it's a concern, especially where you have health facilities treating patients with underlying health conditions, immune-compromised systems. So it is a concern for us, and there's a need to ensure that health facilities have access to drinking water, to treated water. Now I'll be shifting to mental health in the Solomon Islands. It's from the lens of my colleague in the mental health division. Now, mental health the mental health situation in the Solomon Islands is a major concern. And some of the underlying causes are substance abuse and other social factors and pressures in society. We come from a society where there's so strong social cohesion. And one thing that's a beauty of us in the Solomon Islands is we tend to look out for each other. This social capital that we take pride in. And so you would hardly find homeless people in the Solomon Islands because we tend to look out for each other. It is a blessing and also a curse. When I say it's a curse, you would find families who would be hosting people from the village in the urban centers. People in search for better education, employment, who would be housed in the capital. And so you would find host families who would be struggling just to fit everybody in the house. And that is a major concern or contributing factor to mental health issues as well. And sadly, there's inadequate government support. A couple of years ago, one of the mental health facilities had to be closed because of limited government support. And so our patients were left in the hands of families, relatives, and friends, which don't have the capacity to take care of this group, this vulnerable population. And usually in times of disasters, they're often neglected because support is always diverted to the larger population, those who are injured, those who are diseased, those who are suffering from other chronic illnesses, except for those who are suffering from mental health conditions. Also, you would find people who just hesitant to seek for help. I was part of this disaster response team. This was back in 2015. It affected the east side, the eastern part of the Solomon Islands. So I was part of the health team. And in this health team, there was a nurse, a medical doctor. I'm from the water sector, no psychiatrist, no staff from the mental health division. Going into a community who are traumatized, who are in need for counseling. There's no mental health support, no counseling services, no formalized services of such that's available in country. And that even translated to the disaster initial response as well, no such support. There is a drafts SOP that's in place. It was drafted back in 2019 and it still hasn't been endorsed. From what I gathered from the mental health division, they will be submitting this to cabinet for approval. But based on my experience, there's dire need for mental health to be integrated in disaster response. There's also examples of migration in country. A government had to move people living in low-lying areas to safer grounds. And because mental health is not factored into that activity, it has caused a string of social issues for that community and also for the other host communities. There's also need for raising awareness as well of the psychological impacts of climate change. While we do feel the impact of climate change affecting all aspects of society, there is need for our people to be informed of the other psychological impacts of climate change. And lastly but not the least, there's also need for vulnerability assessment, specifically targeting mental health. And this would provide adequate data to tailor appropriate program for a vulnerable population. And that I would like to reflect as well on the assessment I mentioned earlier, the one conducted by the Ministry of Climate Change, Ministry of Environment. It was done on vulnerable population groups. However, it did not capture mental health aspect of this community. So that is a major concern and a missed opportunity as well. So thanks, Greg and team. I look forward to joining the discussion after this.
Thank you, Jimmy. That was a terrific presentation, and learned a lot. And I can see the challenges. Okay, Ginger, and so also I want to thank Dr. Ginger Pobletti, who I work with at the Water Institute, for organising everything this morning. Ginger, if you could just bring all the speakers up. So Jimmy, if you want to turn your video back on, we've got a few questions. I had a couple of questions that I thought we'd kick off, but we've had some from the audience. So I think we might start with those first. And the first one, Jimmy, is for you from Georgina Burgess. So I believe Georgina, you're in the UK. And Georgina said, Jimmy, how are floods taken into account in water security? Water contamination as a result of silt or sediment deposition? And also, how is your stormwater managed in general? Is it being affected by the increased rainfall intensity? So, yeah, urban flooding. Well, sorry, flooding in general.
Thank you, Georgina, and thank you, Greg. In terms of stormwater management, it is an area which is lacking at the moment. Our drainage system is designed to only cater for silt, but at the same time, we have like PET bottles and other plastics clogging the system. So it's not only siltation, but also waste as well, clogging the system. Now, in terms of siltation on our wells, especially, I would like to share just an experience on flooding in the capital. Our last flooding happened a couple of years ago, flash flooding, which affected low-lying communities. And since then, the government regulated that communities should not live X amount of meters along the floodplain. Enforcement is very poor. There's no enforcement, no compliance on that. So that is a challenge. And one of the reasons, or one of the contributing factors well to that is available space for habitation and also for other needs like gardening. And so you would find people still living in floodplain floodplain areas because that's the only area that's available for development. And also during flash flooding, you would find other communities, even within the city, they would use the open wells. And so during flooding, you would find inundation of these wells. And so in those situations, our team in the Ministry of Health is usually collaborate with our Ministry of Infrastructure to remove silt from these wells and to ensure that these communities have access to water as an immediate need. I hope if there's anything else I need to add, just let me know.
Yeah, that was good. And Kashi had Prasad had a follow-up question. If you could just give a quick indication of what the estimates are for the typical consumption in terms of litres per person per day in the Solomons and what people are paying for water.
Sorry, I don't have the data with me at the moment, but I'm happy to share
okay.
After this.
We'll get that out.
To Ginger. Yeah.
Well, that's a good segue into this general question about data. And so, Sarah, what sort of data do you think we need to start collecting? So you've got the 12 elements of the Water Insecurity Index, and certainly worry is one element of that, but getting a little bit more granular. Any thoughts there?
Well, I think we just need to, my life mission is to help people to think differently about water and to measure it differently. And to do that, the way that I think we should be doing it is from the user perspective, or from the, the patient, user, client, however, whatever hat we want to wear, from the human perspective. And so if we are doing that, then we can tie it to all these other health outcomes, and suddenly water stuff can become much more multi-sectoral. So just as an example, is it okay if I talk about the findings in Walgett?
Oh, for sure. Yeah, it's in the public domain now.
Okay, great. So if we measured the infrastructure of people in Walgett, 99% of people, if not all of them, would have improved drinking water source. And so you could tick the box and say, we're good here. But people are really stressed out about their water. People are physically ill from the water, from the salinity of it. So what we need to do is to have individual or at least household level data not on the drivers of water security, like what physical water availability or infrastructure, but on what's happening in their lives. And then tying that to their health or economic well-being is going to give us it's going to open our eyes to what's really happening with water. So I don't know, use the WISE scale. Too long, don't read. Listen to humans.
And just the quick follow-up, in terms of the areas that I think we would like to focus on, particularly the small island developing states, places like Jimmy, what sort of partnerships or methods do you think you could develop with Jimmy, with health authorities in Fiji, Vanuatu, the Caribbean, to collect this? Because it's, you know, our experience from Walgett was that the face-to-face interviews took a few days. You know, they're labor intensive. And any thoughts there?
Sorry, my background noise is.
Oh no, so that would be both for you and Sarah. So, you know, what's the best way to get the data in this type? Do surveys work? Are there other methods that either of you, Sarah or Jimmy, would you think would help?
I'd like to hear from Jimmy on this, please.
Yeah. Okay.
Yeah. So based on my experience, I get data from our counterparts. Face-to-face does work. Based on experience, you know, sharing information via email or by phone call is a major issue. It's a big challenge. Even now I'm here for research, I have to be there in person, face-to-face, to get data. And at the regional scale, it would be good to have like a platform whereby countries will be able to share information, to learn from each other as well.
Great. All right. So,
if I could ask,
please, Sarah.
How do you, as a country, feel about collecting data with WhatsApp?
With WhatsApp or for our society, people would prefer in-person conversation, because first you have to get in person, build a rapport with the community, gain the confidence, and be able to extract meaningful data. Otherwise, if it's by email on the phone, they will tell you what you want to know.
Okay,
what you need
cool.
to know.
That's great. And is there some sort of infrastructure in place in Solomon Islands for regular data collection, household surveys?
Yes, we do. It's through the PHIS system, where and so government does have census data that's regularly carried out in country. Health also does the surveys as well, but it's not for the whole population. We have our limitations as well in terms of resources to reach all of the population. So that's one of our limitations, funding. But so, and also if we were to explore the option of, you know, WhatsApp telecommunication, it would only be accessible in mainly the urban centers. Most of the rural population would miss out because of limited telecommunication coverage.
Is there any possibility of inserting questions into national surveys, for example?
Yes, there's a possibility for that. And probably a good opportunity would be to start a dialogue with the government before the next survey, the next census survey.
I have ideas. I have suggestions.
Right.
Well, I'm happy to connect you to the corporate government ministries in country to start the dialogue.
Terrific. We've got some questions for Zhao. Zhao, one's from Claire, and I was going to ask as well, and I think they're connected. You know, your success, particularly with the Green Space program, is all about taking the data and then using it in advocacy. I'm just following up on Claire's question that which I've just lost.
I answered.
Claire, could you, it's here somewhere, wait a minute. But no, you ask it, Claire. Welcome. And thank you for staying up late.
Mm.
So thanks for the question, Claire. I think I put in the it's now in the answered part, because just in case we run out of time. So Claire was interested whether the green space quality was was including about anything about like water fountains. Yes, this is actually in the part of the project. We're looking for rare things, and probably beyond the fountains, such as a pond. Some of the parks have lucky to have some water features, but not necessarily all the park currently have it. It depends the size and the location. And I guess the urban green space, a link probably between the water security is actually more than we think, because when we talk to the council, they're thinking about to plant more trees, have a great parks. But the problem here is that where the water come from, because in Australia's climate, especially we're now getting hotter, we see all the news recently, and I think that's probably going to be the case. This is one of the warmest winter I have experienced in Australia, in Sydney. So if you plant new trees, especially not the established trees during the summer, even in Sydney, it's going to be a problem. And if you don't have the good irrigation system, and if you don't have the water, and if so then those trees will die. So whenever now they start to plant new trees and plan for the new green space, they have to put this on their agenda. But I also just echoing, what the Sarah's research, particularly I think there is this solastogin, which is essentially the considered depression from the environment. And you can see that there's some public park in the summer this is really become kind of like a yellow dying grass there. And not too far away in Sydney, there is a private golf course, and you see everything's great, it's green. And this could really cause the community feel distressed about their mental health as well, by this comparison that, this public available park and it is yellow and because of lack of water, but on the other side that this private golf course not allow everyone to access and is well maintained. I'm sure this is not just in Australia, but also overseas as well. And I think we really need good data, especially local data, to show that the waters, how it have impact on people's mental health. For example, like my research, at the very beginning, this is what motivated me about, I think over 10 years ago, when I presented at the very beginning about green space and health, the policymakers, counselors really interested. And then they asked me a question. They said, so how much green space we needed really for, improving our mental health and physical health? I said, well, that's $1 million question. I don't have it now. But luckily, during the last 10 years, I secured funding and continue to use our local big data. And it shows that 30% is a figure we need working on. And this is exactly the figure that my local council, City of Sydney, and many others, and now even overseas, they are aiming for 30%, like Sydney, even more ambitious, aiming for 40%. And I think we need to make sure we have those scientific data and research to back up. When the policymakers, they make the policy, they can say, well, this is the research, this is evidence we get locally, and that's why we make this policy. So I think, earlier we already discussed with Jimmy and Sarah and how important that we collect those data and all using the existing data available here to provide the scientific evidence. Thank you.
Thanks, Xiao. All right, so I think we've pretty much covered most of the questions that we have. There's a couple more from again from Georgina, who's in New Zealand. I apologize about that, Gina. And it's linked, Jimmy, to your photo of the desalination plant, and we have in parts of New South Wales and Australia, again, salt in the water is a real issue, and our colleagues at the George Institute have been leading our work on looking at increased levels of salt Is there any work in the Solomons on, trying to improve the salinity in addition to the desal plant? And then in general, Georgina's asked, have there been studies done linking water consumptions to decreased levels of anxiety and anomalies in the brain development, and how potentially could this be managed?
Yeah, thank you, Georgina. Going back to the project I mentioned, that was just a one-off project. It was a pilot, and when it terminated, it ended there. There wasn't any other phase of the project. There was none. And your question on, sorry, what was the follow-up question again?
It's just linking water consumption to decreased levels of anxiety.
There's no such studies that was conducted in the Solomon. So there's opportunity for that. Okay. If anybody's interested, there's an opportunity for that to be done.
All right. Well, look, I know some of you, Claire, is staying up particularly late, and it's beginning to get late in Chicago. Sarah, or are you still in Mexico?
I'm back from Mexico, but I do have a dinner date.
But look, so I think we'll wrap it up here. First of all, thanks everyone for your interest in attending this morning. This is the first of a couple of webinars on this issue that we're beginning to organise with the Water Institute, and we're grateful to our colleagues at London School of Tropical Health and Medicine, Sarah at Northwestern, Jimmy in the Pacific. Our next one will expand the scope a little bit, and we'll be having colleagues from the Caribbean and Africa, and Mexico will be joining us, and Claire will be hosting that from the UK later this month. So on
Greg,
behalf
if I can just rudely interrupt to say, so Josh put something in the chat that
Josh, about North Carolina. Yeah, apologies.
No. Josh, are you speaking? Should I put words in your mouth? I'll put words in his mouth. It won't be the last time. We have a session at the UNC Water and Health meeting, which is in North Carolina. It's a fantastic meeting. Generally, I recommend it to anyone who is interested in water and health. But we have a session dedicated to experiential measures of water insecurity, shockingly, and where we'll talk about what we have done, but also future plans of, we're developing a scale to measure water insecurity in institutions. So prisons, schools, clinics. We would make a possibility for you to be a speaker in that session if you would be interested in attending.
Excellent.
Done.
I think, yeah, we'll work with Jimmy to make that happen.
Thank you, everyone. It's a nice discussion, and thanks for all the questions from the audience.
And thank you, Ginger, for pulling everything together. So wherever you are, enjoy the rest of your day, no matter how long it is or short it is, and look forward to seeing you all again soon. Take care.